Hi, good afternoon. Welcome to the St. Clair County Health Department's Facebook Live. I'm Dr. Annette Mercatante, and I have with me today our very special guest, Mr. Kevin Watkins, to help us talk about health equity and the issues of COVID in the minority populations. Kevin, introduce yourself.
Hello, hi again. My name is Kevin Watkins, and I'm happy to be here with Dr. Mercatante here at the Health Department to educate you. I wear three hats. I am a proud St. Clair County resident in Wells Township. I am a professor at SC4 Nursing College, and I am the president of the Port Huron branch of the NAACP. So we are, up here we want to educate as a nurse. What we do and what nurses do best is educate, and I'm hoping in this forum to help educate you on the vaccines that are so important for us to stamp out this pandemic that has stifled us over the last year.
One of our most important components of this disease is to make sure that we, especially now with vaccine available, is that we distribute the vaccine in the most equitable and fair way possible. And we know that sometimes different communities perceive things differently. And so we're really happy to have that conversation today. So let's first, as we always do, go through the data. Today's totals were up to 7,803 total cases, with a total of over 400 hospitalized and unfortunately 195 deaths. Our deaths continue to climb. We have over 5,000 people recovered, but that means a whole lot of people who are walking around still sick. We have about 50 new cases a day. This is kind of our new average. We've been there for over a week, and perhaps we'll see some further decline, but this seems to be our new normal right now, with about a 11 to 12% case positivity rate with our testing. Here's the graph that shows how we had that big crescendo, that big peak around the holidays in November and December. It's come down, and now we are kind of at this new plateau, about halfway down that curve. As I mentioned earlier, when we get to that 100 cases per day, it really overwhelms not only our system, but the healthcare system in general. 50 cases a day, we're just really, really busy. A caseload of 10 to 20 per day is a much more manageable approach, and we'd like to see this come down significantly further, and hoping it will. And this is our testing capacity. It did drop a little bit over the holidays, but the past week we have seen some improvement there. We want to see testing continue to be robust. Please, if you are ill, please seek testing. And if you have been exposed and you feel like you'd like to have a test, again, it's best to wait 3 to 5 days, but that testing is available. Check our website and you should be able to get testing at no charge. Also, our case positivity rate has come up and it's staying up. So that's generally a sign that the COVID is going to be with us here for some time to come. And then this is a new table. We'll make it prettier for you as we go, but I wanted to make sure that we start reporting on our vaccination capacity. So far, St. Clair County has received a fair amount of vaccine, and as you know, vaccine is coming in kind of at a trickle. The total number of St. Clair County residents who've received at least one dose of vaccine is 4,169. But I also want to show that St. Clair County Health Department has distributed almost all of the vaccine, and what we haven't vaccinated has now been accounted for in the clinics that we have over the next 2 days. So we're not sitting on vaccine, we're moving it out as quickly as we get it. And we're going to continue to show this data on are we going to put this on our website? Yes, okay. So this data will be available to people as you go. And then this is our dashboard that will continue to update and show daily changes with cases, deaths, etc. I didn't talk about hospital situation. Our hospital capacity remains good. Are we at under 20%? Under 20% of all hospitalized patients in the county are COVID related. So we're standing in pretty good shape with our hospitalizations. So that's our data, and we'll get right to your questions. Jennifer?
Okay, we'll start with Kevin. Why are vaccines less accepted in the Black or Brown communities?
Well, look at reason why that is basically looking at the history. A lot of people in the Black and Brown community remember some of the things of past when they look at governmental driven projects in regards to studies and how Black and Brown people were used in the past to as experimental, basically as in the experimental, as people would say, as guinea pigs to find out how medications work, and especially they look at the project that was done in the 30s, 1932, when it was started, the Tuskegee Institute project, where that they purposely infected a serious number of almost 1,000 of African American men to study them to see the progression of syphilis. That project went on for many years until it was finally stopped because of outrage for the public once the word got out. So things like that, that's one big example that many Black Americans know about, and they're concerned about that if we get the vaccine, that because the vaccine is a new vaccine, that if us being injected with this kind of studies to see how the results or if there's any side effects or any deaths or any problems with it, it'd be on the Black community to master that data. So that unfortunately is an issue that we have to work through. But that's one of the main points I think that most people that I talk to in the Black community that's concerned about taking the vaccine.
Yeah, I'll just say that this is a pretty important issue. Recent national surveys show that the Black community is the least likely to have the acceptance of vaccine, on as little as 40% of the population, compared to the general white community with over 65% acceptance or thereabouts, depending on the demographics. And probably more important than that is that we know now that COVID is disproportionately affecting communities of color. Not only are they infected more, but they have more serious consequences. There's a higher death rate throughout, and this has been shown was earliest data was shown right here in Michigan and has been consistently shown throughout the nation. So I think making sure that we make a special effort to our brothers and sisters of color is a very important priority for us. We want to make sure that we address their concerns. It is still a voluntary issue, but the more, as Kevin mentioned, the more we can educate, the more we can listen, and the more we can understand, maybe the better off we'll all be. So I'm excited about being able to address this issue.
Speaking
we have
of
another
that,
question.
Yeah. Speaking of that, just to kind of build on that, Kevin, what do you think it will take to build trust within the community of color?
Well, that's a good question. Basically, it's time. Most of the key is the education to be honest, forthwith with the information, and then as people get vaccinated, to monitor them, show support, keep the data out there, and basically be open with the information. I think it's important for those leaders in the community, once they're educated, especially those like myself that have the information. So I do a lot of educating people around me, a lot of my NAACP members, clergymen, and basically the whole entire Black community here in Port Huron, and those in other municipalities. That this is very important. This is serious. This pandemic is upon us. This vaccine, I use comparisons, for example, like years ago, the polio vaccine, mumps, measles, rubella. I always take people back to understand that in the early 20th century, if you do some studies and see how children were dropping like flies from basic things like mumps, measles, rubella, whooping cough, and then the polio vaccine, how that decimated society. It was vaccines that saved us. So we have to look at that this is going to be the vaccine that's going to help save us. We have right now, we're holding fort with wearing masks, which is very important, social, physical distancing, which is, we say social distancing, but basically it's physical, because we are social beings and we need to be socially together, and our technology helps us do that. So the mask, physical distancing, and then what we should always have been doing from day one is good hygiene. That's holding the fort until these vaccines come and save the day. And we have to think about that. We have pretty much wiped out mumps, measles, rubella, whooping cough, polio. Why? Because of the vaccines. We're going to wipe out this coronavirus. Why? Because of these vaccines. So some people have to take this leap of faith in regards to these companies that have developed these vaccines in warp speed. That's one of the things that people are concerned about. It was done so fast. Well, we have more technology than we had back in the 30s, 40s, 50s. We can get things done. This has been a joint project amongst many scientists across the world who come together and with these pharmaceuticals to come up with this vaccine. So it is real, it is safe, and I'm here myself to promote with Dr. Mercatante of all, especially my brothers and sisters of the Black community, Black and Brown community, who have those reservations about it. Now, this is important because it's affecting us at a higher rate, and for a number of different reasons that we can get into.
Thank you.
One of the things I do worry, I just want to piggyback, is that one of the concerns I have with health equity is that as this rolls out and we continue to follow through with vaccination, that if we don't encourage our more hesitant populations to be part of this process, to be part of the vaccination engagement, we will have two separate communities. We will have a very vulnerable community that's susceptible to infection, and we'll have one that's more resilient and less susceptible to infection. And that has all kinds of implications. As we know, there's already issues with healthcare access and health well-being to begin with, baseline health. There could be, for instance, work-related issues. So if the only kind of job you can get is if you can prove you aren't going to get COVID, either that you've been vaccinated or you've already been infected, I could see these being further barriers, not just for health, but for social and economic well-being as well. And I just don't want to get there. I'd like to avoid it. And I think that means we got to listen and be listened to, right? So that's kind of why we're here. I'm here to listen, but hopefully people will listen to you, Kevin.
Yes.
Okay. All right.
Okay. Why don't we look down, Doc, at your talking points? And a lot of questions have come in about the current vaccination plan. Can you just go over that so people have some clarity?
Yeah. So as you know, this is a rollout that is never going to be perfect. The vaccine rollout has started as in late December, and has been rolling out pretty slow. Our state was promised a certain amount of vaccine allocations from the federal government, is getting about, a quarter of that. So the state's receiving at this point about 60,000 doses of vaccine a week, and then they reallocate that to all of us. The hospitals get some. There's a system in place to vaccinate long-term care facilities through the Walmart CVS contract, and then local health departments get some. The hospitals are responsible for vaccinating their staff and people, the healthcare providers, that 1A group, and we are doing what we can to assist them with that. The rest of the vaccine, that lowly 1,000 doses a week that we're receiving currently, is what we have to try and use now for all of you. And as you know, the governor extended that priority group now to include all essential workers, as well as everyone over the age of 65. That's about 60,000 plus people in our community alone. So that's just clearly to show you mathematically that people, we can't vaccinate everyone all at once. And we're going to have to just kind of work on this. There has to be amount of patience. There are obviously people who need it more, want it more, but there's only just so much to go around. So this is our process right now while we have a very limited amount of vaccine. And I guarantee you, we're going to fight for more vaccine. And the more vaccine we get, the more we're going to expand the access to it. Okay, so as much as we get, as I showed you on that table, the more we're going to put it out there. But right now, we receive an allocation, a number that we're going to get on a Friday. And as a result, we will schedule our clinics. As you know, we have some clinics at Blue Water Convention Center. We're going to always try and establish a clinic in one of our southern or western communities. We are working on a drive-thru clinic, although that's not set up yet. So we'll have a variety of options for clinics. And those clinics will be available by appointment through a link on our website. Now, if you're not technologically savvy, you don't have internet service, the solution for that is coming. There is going to be a 2-on-1 operator available to assist you with scheduling those appointments, and we are also looking for other community partners as well. So there will be an option for people who don't have the ability to directly access. But until then, and that probably won't come until next week, until then we urge you, for a family member or a neighbor or somebody who has internet to assist you logging onto our website, scchealth.co. It's really obvious, the link to make an appointment. Click, that's where you go. And when the appointments are gone, there's no more appointments available. They will be closed until we get more vaccine. So those vaccines, those appointments will start showing up Friday afternoon. Look on the weekend. Look on Monday. We receive our vaccine on Monday. We recount our allocations. We make sure that we're putting all the vaccine out that we can. And then we start rolling our vaccine clinics out for the remainder of the week. It's possible that clinics will open up further. So we have no-shows. We have extra doses in each vial. Not every single vial, but we have recently been advised that we can, in fact, if we have a full dose in a vaccine vial, that we can use it. Prior to this, we could not. So now we know we can use it. So sometimes that's an extra 50 doses of vaccine.
Piggyback on
Sure. So that's the process, basically. And so what we want you to do is look to our website, and as soon as we have more options, we'll put them out there, and we'll just keep rolling along. And I fully expect that every week we will have more and more vaccine to offer you. We just have to wait for it to happen. I can't produce vaccine. You cannot order this vaccine from a pharmacy. This vaccine has to be allocated to us from the state government, from the Michigan Department of Health and Human Services. They receive it first, and then they push it out to us. So until that process changes, we're kind of limited. So Kevin, I heard you. Do you have a question about that?
Yes, Dr. Mercatante, I think I'm going to ask a question that many that are viewing in now may have. We all know that right now the vaccinations are in 2 doses. So those who come and sign up and come get their first dose, do they sign up right then at that time to come back for the second dose? And are they guaranteed that there'll be a dose available for that second dose within the time frame that's necessary to be taken?
So yes and yes. So we are scheduling a person's second dose clinic before they leave the clinic after getting their first dose. So that's part. We're at to ask everyone, we'd like to wait for 15 minutes after the vaccine. That's a normal waiting period for the vaccine to make sure there aren't, you're not going to faint or have problems with the vaccine. So we have you wait. And while you're waiting, we have you sign up for your second dose appointment. And we also give you information related to a national surveillance program called Safe, which provides this kind of constant surveillance. They'll ask you every day how you're feeling, and you can mark it in. So we can have really good data on side effects of the vaccine. So yeah, the second dose. Now, can we guarantee the second dose? I think so. As you know, the federal government was withholding the second dose to be sure that that was in fact guaranteed. And now there is such an outcry and such a concern with cases surging throughout the country and the new mutant. I think there's a sense of urgency to get as many people vaccinated as possible with the first dose, with the trust and the understanding that the manufacturing process will keep up, and it's building as we go. It's like a train growing with momentum, so that second dose will be available. I have to say, will that second dose be available on day 21 or 28? Maybe not. We might have to give it to you a week later, but that's okay. We know that's absolutely fine in the vaccine world. You don't want to give a vaccine too short between doses because they interfere with each other, but prolonging the second dose by a week or two, or actually even longer, has never been a problem, and it's not going to be a problem with this vaccine either. So yes and yes, to try and be succinct.
So Kevin and Doc, maybe you can talk about, is there been thought about strategies on how to reach those vulnerable populations who might not have transportation and such to come to a clinic? Is there anything in the works as far as those kind of things, or anything you can talk about?
Well, let me start, and then I'd like Kevin to finish by what he'd like to see. Because I've started by reaching out to these communities and saying, what do you need? What do you think? And what I'm hearing first is, we have a lot of concern about the vaccine. So to me, the place to start is to address those concerns and to listen, right? And to listen and hear what people want. But certainly what we know is that if a person can't get in a car and drive to a clinic on the north end, that we need to bring the clinic to them. And we are certainly willing and capable of doing that, having dedicated clinics in communities that need it. We just need to know about it, and we need to plan and do that together. We need to have a coordinated effort so that we don't build a clinic and have 4 people show up, right, or something like that. We want to make sure that it's successful for both of us. So with that, I guess I'm curious what you think, Kevin.
I think that's an excellent idea. You answered the question for me in regards to as far as bringing the clinic to the people in their communities. I would love to see at one time a mobile unit that can be that go place to place to and let people have a time. You utilize their our churches, letting people the information out where the mobile unit would be, or where locations in their community that the health department will be there administering the vaccine. That's going to be key because a lot of times, because of transportation, people have issues with that now. The reason why they not have great nutrition, because they can't get to the areas where they get the more healthier foods when they live in the food desert. So that is very key, is basically come to the people, bring it to them. There's a number of ways we can do it in a mobile unit, or your state has set up certain places in community at churches or at their basic community halls, set clinics up there to do vaccinations.
So I want to follow up on that, because that's we have a mobile unit. Yay. I mean, this is exactly what we're thinking we'd like to do. But we feel like we need to make sure that the population is in fact ready and willing to accept the vaccine. And that process of how do we get, obviously you being here, but we want to make sure, and of course it's not a one and done kind of thing. Nothing is a one and done thing. We're gonna work on this and do something, and if it works well, we'll do it again, and if it doesn't work well, we'll rethink it and try it a little different direction. But trying to prepare the community so that we have an eager, or at least a somewhat decent group of people who are willing to get started with it.
Okay.
True.
Well, since we're on the road about talking about vaccination, I believe, Kevin, you're going to be vaccinated by one of our nurses today. Are they ready to go?
Yes, I believe in leading by example.
Okay. All right.
Okay. So while we're getting ready for that, we'll say that we are in fact using Pfizer product at this time. We started with some Moderna. Many of you may have received Moderna, and the second dose of Moderna is guaranteed, as I mentioned to Kevin. And now that we're using Pfizer, there's a good chance that starting as things start to open up, we'll be using both products, and we will have a situation where we'll know one versus the other. What I want people to remember is that if you start with a Moderna product, you need the second dose to be a Moderna product, and vice versa for Pfizer. If you start with Pfizer, you need to finish with Pfizer. And so we'll be asking those questions. It should be on your card. Try not to lose your card. But if you do lose your card, we can look it up in the MICR system, and we'll know what to give you. So no worries there. The only difference between Moderna and Pfizer, quite honestly, they're both similar types of vaccines called mRNA vaccines, a new technology that is very exciting and is proving to be very effective and very safe. But the Pfizer product has an interval of 21 days and can be given to 16 and older, whereas the Moderna product has a 28-day interval between dose 1 and dose 2 and can be given to 18 years old and older. So very little difference. Other than that, it works the same in your bodies. It has not identical components. The mRNA component is identical, but it has a little different lipid envelope around it. And so really, I would not suggest that you wait to get one product or the other. My suggestion is that you get the product that's available for you when you can make that appointment. Especially since if you can get in there, we want you to do it. I believe he's ready. I see an arm exposed. Mm-hmm. So our nurse is going to give the vaccine in the deltoid muscle. It goes in the deltoid muscle. It's important that it goes in the right place, not too high up into the shoulder. Our nurses are expert at this. You'll notice that she's not wearing gloves. We almost always get some comment about you do not need to wear gloves to vaccinate. There's no bodily fluids involved. So there's no risk of infection. How did it feel? Okay?
I didn't feel it at all.
Great
Good job.
job. Now, all individuals who get vaccinated will be asked to wait 15 minutes. And if you do have a history of a more severe allergic reaction to something else, especially an injectable component, you'll be asked to wait for 30 minutes. We are always prepared, and every vaccination site is always prepared for allergic types of reactions. We generally usually have to do nothing more than have a person kind of put their head down if they're a little dizzy. It's probably by far the biggest problem. We have people getting a little lightheaded or dizzy. Kevin, you let me know if you're feeling all right. Once Cindy's out of the way, you can take your mask off and talk some more to us. But that's basically it. And then you're off on your way, and you just got to remember to come back for that second dose. So it's a pretty painless process, right? How do you feel?
Great. That was very painless. No problem whatsoever.
I'll brag. I think our nurses do probably the best job of anybody I've ever known giving shots. Not that you can't get a shot from anybody who's trained and appropriate to give it to you. But so what else do we want to talk about? Jennifer, do we have any other questions before we wrap up?
Yes.
Thank you very much, Kevin, to show your fortitude.
Thank you. Yes, we have several questions. These are about the vaccine and the timeline. So why don't we have a wait list for the vaccine?
Well, the simple answer is because it creates so much work on the back end. We don't have all of our staff is working towards providing vaccine and keeping that vaccine flowing out and into people's arms. If we have a waiting list, there's going to be a long process of calling people. And literally, there would be thousands of people on the waiting list that we would have to call back. Then you ask yourself, how do you prioritize the waiting list? How do you make sure, you call a person and there's no answer? Do you leave a message? That's kind of a HIPAA thing, right? You can't really leave people messages on their phone. So it's a pretty complex process. We figure it's just easier to push the information out and let people find the clinics at their convenience. And again, I'll mention it again, as more vaccine becomes available, more clinics will be available. And I don't think it'll be surprising at all. We're distributing easily 1,000 vaccines a week. We'll be at 2,000 vaccines next week. And we will be able, I'm sure, to quadruple that over time, especially as more partners get involved. So vaccine will be available to you. And if you can't get it in one place, we'll be providing you information of where else you can get it. Okay. I guess that's the best answer I have for that. It's just not a process we think is going to be very effective.
Another question was, can people go to different counties to get the vaccine? Or should they wait?
So that's a really good question. This is a federal asset. So this is your taxpayer dollars that have gone into developing and manufacturing this vaccine, and it's a state asset. St. Clair County doesn't own this vaccine. So in my opinion, this vaccine should be available to anyone. However, vaccine is currently in very short supply, and it's being allocated. It's being distributed so much to one county based on the population versus so much to another county based on the population. So if you're skipping around, in a way, you're kind of pushing another individual out. I would encourage you to try and stay in the county of your residence, just as far as just being fair. But if you are somewhere else, if you're working in another county, and it's probably happening a lot where a vaccine is becoming available through your workplace, by all means take advantage of it. It's not illegal to get a vaccine in another place, but because we have such a short supply, we're really encouraging people to get it for the county it was intended for.
Okay. How long do people infected with COVID have to wait before they get a vaccine?
As soon as you feel better and you are technically out of isolation, which most people are no longer infectious 10 days after the first day of their infection or first day they feel badly. So that 10-day isolation period and overall just feeling better. I can tell you, though, that most of the literature, the science, feels that there's a fairly good chance you're not going to get reinfected within 90 days of your infection, that there is natural immunity that's going to last at least that long. It's very rare to see a reinfection within 90 days. So if you want to put off your vaccine, you should put it off. You can put it off about 90 days, but you don't have to. You can still choose to get vaccinated early if you want, as long as you're not actually sick anymore.
Okay. Speaking of COVID itself, Kevin, can you talk about the experience that the Black and Brown communities have had with COVID itself?
Oh yes, well, basically is the fear, looking at the statistics that we are more at risk, more affected by it. There's various reasons why. I'm sure a lot of people have heard these reasons. Is basically because most of a great number of Black and Brown people are frontline workers, just as far as being exposed, have to go out the home, not be able to work remote. And have more risk to be exposed to the virus. Then you look at historically why certain communities have less access to healthcare, maybe have no insurance, less access in regards to transportation to get to healthcare. A lot of communities live in what we call a food desert, where their nutritional status is very diminished. Maybe it's based on social economics, may not have the resources to get those things that help you stay more healthy, like supplements, vitamins, those sort of things, and some things just genetic. We know that the studies show that most Black and Brown people are more at risk or have a vitamin D deficiency. A lot of that's just because of our pigmentation. We don't absorb because our dark pigmentation absorb that vitamin D that we get from the sun. So we have those risk factors there already. And then we look at the comorbidities based on you're more those in the Black and Brown community who have hypertension, diabetes, and from that maybe some kind of lead into some renal disease. So you're already compromised. So when your body is compromised and the virus attacks you, you're more apt to have a less of a positive response as far as being able to fight that. So that's one of those main reasons why we're more at risk and why it's so important to take the vaccine because of that. Because we're not only more a risk of not as much as maybe more the same as contracting it, but as far as surviving it, and there's more deaths. The studies show over the Black and Brown communities, and basically it's because of those comorbidities and those predisposing factors before even being infected. So that's one of the major reasons I feel that it's so important to take this vaccine, and that's why I came here to do this and leading by example and taking it myself, because I have those issues. I have some, based on, I'm a black male, and I'm more high risk to hypertension. I have hypertension. I have diabetes, so I'm more at risk. So it's important. I have to do the things I need to do to stay healthy. One of those things is to take this vaccine to help prevent beginning COVID, because if I get COVID, I'm less likely to do well.
Thank you. So
Thank you.
speaking of the
chronic, I just want to say one more thing, Jen. It's an excellent explanation. I just want to reiterate the fact that the difference is we do not have treatment for this virus. And as someone who's recovered from this virus, I can tell you it was brutal. It was a month and a half before I felt functional again. And that is just, I wouldn't wish it on anyone. And the vaccine actually prevents the infection from happening. So it really is getting up in front of this to keep you healthy. So please go ahead.
We've had just kind of what Kevin said, just about chronic diseases and such. We've had some questions from people about those people who fall into that phase where people with chronic diseases can come into play to get their vaccine. They want to know when that phase is going to open. Do we know that?
I do not know that. I didn't think we were going to open to 65 and older as quickly as we did, because we hadn't even touched the surface of the 1Bs by the time when that happened. I think it's going to depend on vaccine availability, to be honest with you. And as soon as we can, that floodgate opens and we see a lot of vaccine coming into the community, I don't think there'll be any reason to hold back on that group. I have heard that it'll be in the spring, but honestly, I don't know.
So somebody wants to know, as far as if they're in a special priority group like the 1A, 1B, how do they get information on their clinic, their closed clinics, so to speak?
Well, that's a good question. We hopefully have access to know where you're working from. But if somehow you're working outside and you have not worked in an organization where this information has been shared with you, you have to get in touch with us. I would say send that information to us through the COVID-19 email, because our phones are ringing and it's always hard to get through. So the COVID-19 at stclaircounty.org, and let us know your profession and that you've somehow been overlooked. And we are still holding special the clinics that are, if you will, closed except for just essential workers. So these are links to making appointments that aren't available to the general public, and so we'd want to send you one of those and make sure you get in. And if that doesn't work, go to a general clinic. Just get your vaccine wherever you can. No one's going to turn you away if you go to a 65 and older clinic and you happen to be a healthcare worker. We'll still vaccinate you.
Okay, there's some more questions coming through, so I'm just going to start rattling them off, okay?
Okay.
Somebody wants to know about, if we do a drive-through clinic, how are we going to monitor allergic reactions after that 15-minute waiting period? What's that process going to look like?
This would be my operational people, but we'd obviously have your car pull over and sit in a certain waiting area that would be monitored by a different set of staff. So you stay in your car, you just be asked to stay in your car in a different section to be watched.
All right. Someone else wants to know, should we expect the majority of the county to be vaccinated by spring with the current amount of vaccine that is available each week, or is the fall more realistic?
The fall is more realistic.
What are your thoughts on the upcoming Johnson & Johnson vaccine?
Well, I'm hopeful. It's a one-dose series, and Kevin and I were talking about that earlier. 2 doses is problematic for a lot of reasons. It's hard to get people to get in for the first dose, let alone the second dose. And we're concerned that people won't bother coming in for the second dose, which means they won't be fully protected. So if the Johnson & Johnson product is just as good or almost as good with a single dose, I think it's going to be a win. The question is, I don't know if we're going to have enough of any one vaccine to do everybody. So, we're probably going to have to just kind of use them all in the best way that we can.
Somebody wants to know, if when they make an appointment online, can they make it for their spouse at the same time? And I don't know if you know that, but I do if you don't.
There would be no. So we need a different name and information for each appointment. So what you could do is do it, submit, and then go right back into the link and try and do it for the other person, though, right?
Yes, that is correct. Okay. Somebody wants to know that their mom's 77 years old and a Wayne County resident, but she's staying with the daughter in St. Clair County. So can she get vaccinated in St. Clair County?
Of course. Of course. The purpose is to vaccinate people. Again, this isn't, we don't own anything. We want to get, if your mom is living with you, it'd be way easier to bring her, I think, in St. Clair County. Again, that would just be up to how things work out for you. Now, if it's readily more available in Wayne County, for some reason, and you can get it there, by all means. But I would say either way would be acceptable.
Okay. And lastly, somebody went to sign up because it said it was 65 and older, but then it was told to them through the message that it was for A1. So somebody must have gotten on the wrong link or been sent a link for a closed clinic. So 65 and older will be on our website. The closed links will be not on the website. Just
correct. Clarify. So if you're in a special group, if you're an essential worker, you're a teacher, or you work for a special, road commission, all these people that we consider essential, that we can't function as a society without you. Our goal is to provide you a link that's generally not available to the general public. The problem is, once we send that link out, people can share it, right? We don't want you to do that, because then it ruins it for. But we know that this happens. It's not a perfect process. And I've said this earlier to Jennifer. We get like, I know so-and-so got a vaccine at a clinic and she wasn't part of the group. And this is what I can say to that. Our goal is to vaccinate people. And if we make our criteria and our process so strict and rigid that only the right people get in, we're going to create barriers that are going to make it harder for people to get vaccinated, and that's not what we want. So instead, we're erring a little bit side on the easier side, which means sometimes things will get through, but at the same time, we're trying to reduce the barriers. We still want people generally to follow these rules, but we're relying on people's goodwill and their nature to do the right thing, to stay within the categories we're providing.
Thank you. Okay, one more question, and then we can do closing comments. Is there any information on children getting the vaccine?
So what I heard through some of the webcasts is that those trials, clinical trials, are ongoing as we speak, and that there is a different standard for vaccines approved for children, and that they are thinking that those trials and that information will be coming out probably towards the end of the year. And I absolutely believe there will be vaccine available for children. I just don't think it was on the first tier of what people are trying to get done. So it will come. It probably won't be any time within this near time frame within this year.
Okay. So before you guys do your closing comments, I just want to reiterate, hopefully Friday afternoon, can't tell you exactly what time right now, but we will have know more about our clinic and vaccine count for next week. So watch our website. We ask that people who don't have access to internet, if they can find someone to help them, that would be great. We're working on strategies to increase that. We're working on strategies to increase different types of vaccination venues and arenas and people doing them for us. So stay tuned for that. If all possible, please, those people who can not call, go to the website. If you're tech savvy, that's great. If you're not, please reserve our phones for those people who don't have internet access. That would be very appreciative. Okay, thank you very much, Kevin, for coming on. What are your closing thoughts today?
Well, thanks for having me first, Dr. Mercatante. It was great being here. I say this is serious. I want people to hear me. This is serious. This has come upon us, but we have to deal with this. We can get through this. There is light at the end of the tunnel, and that light is Pfizer, Moderna, Johnson & Johnson, and there will be others who, with Operation Warp Speed, has come up with these vaccinations to help prevent this from this COVID-19 can absolutely wipe out our senior population, and then start working on the rest of us. So we have to face it, understand that we're at a reflection point now that we can really fight back, and we can fight back if we don't put the gloves on. And putting the gloves on is taking the vaccine. And I speak that to all, but I'm really looking right now at my Black and brown brothers and sisters, understanding that we are more at risk not only to contract the virus.
Shoot.
Oh, sorry, everybody. Technical
Right at
difficulties
the
there.
right time. I know, always at the most important point.
Yeah.
So I really appreciate the conversations we're having. I think we need to keep having them. People, be patient. We care. We're trying to do the absolute best we can. I cannot sit here and say that we're not going to make mistakes, and we're going to do things not perfect, but we're going to figure out what we're doing wrong, and we're going to switch it. And I think we have to go back to what Kevin Watkins is saying here, and that is we have to take this seriously and work together. And sometimes we have to be willing to be in a little bit of an uncomfortable place, knowing that as we move forward, things are going to get better and better. And there is light at the end of the tunnel, but we're still in the tunnel. So don't let your guard down. And thank you for joining us. We'll continue to provide you as much information and support as we possibly can. See you next week.